Did you know that over 850 million people worldwide suffer from kidney disease? Yet most don't realize it until it's almost too late. Your feet might be trying to tell you something crucial about your kidney health right now. What if I told you there are 9 warning signs hiding in plain sight on your feet that could save your life? Every day, millions of people over 55 ignore subtle changes in their feet, not knowing these could be early warnings of kidney failure. The kidneys are like the body's filtration system, working 24 hours a day to clean your blood. When they start failing, toxins build up in your body like garbage in a clogged drain. But here's what most doctors don't tell you. Your feet often show the first signs of this silent killer. Kidney disease affects people in this age group more than any other, and waiting too long to recognize the symptoms can mean the difference between manageable treatment and life-threatening complications. Why do some people maintain healthy kidneys well into their 80s, while others develop serious problems in their 50s? What are the 9 specific foot signs that emergency room doctors look for when they suspect kidney disease? And how can you protect your kidneys starting today, even if you've already noticed some of these warning signs? I'm going to reveal all 9 of these critical warning signs that appear on your feet, plus give you the exact steps doctors recommend to protect your kidney health at any age. Before we dive in, please subscribe to our channel and ring that notification bell. Let us know in the comments where you're watching from today. Understanding kidney disease starts with knowing what your kidneys do. Think of your kidneys as 2 bean-shaped filters, each about the size of your fist. Every day, they filter about 50 gallons of blood, removing waste and excess water. When healthy, they work like a coffee filter, keeping good things in and letting waste pass through. But when kidney disease develops, it's like that filter getting clogged. Waste backs up into your bloodstream, and your body starts poisoning itself. This happens gradually over years, which is why many don't notice until damage is severe. Chronic kidney disease affects 1 in 7 adults worldwide. For people over 55, it's particularly dangerous because it often develops alongside diabetes and high blood pressure. Your kidneys connect to every major system through your bloodstream, so when they struggle, effects show up everywhere, including your feet. Now let's examine the 9 warning signs that can appear on your feet when your kidneys are in trouble. Remember, these signs often develop slowly, so pay close attention to any changes you notice. Sign number 1, the blue toe syndrome, also called purple toe syndrome. This alarming condition causes 1 or more of your toes to turn a deep blue or purple color, almost like they've been bruised. But there's no injury causing this color change. What's happening is that tiny blood clots or pieces of cholesterol plaque are breaking off from damaged blood vessels and blocking the small arteries that supply blood to your toes. When your kidneys aren't working properly, they can't regulate blood pressure effectively, which puts extra strain on all your blood vessels. This increased pressure can cause plaques in your arteries to become unstable and break apart. These fragments travel through your bloodstream until they get stuck in the tiny vessels of your toes, cutting off the blood supply. The affected toe or toes will feel cold to the touch and may be painful, especially when you walk. You might also notice that the blue or purple color gets worse when your feet are hanging down and improves slightly when you elevate them. This is a serious sign that requires immediate medical attention because it indicates significant problems with your circulation that could affect other organs too. If you notice any unexplained color changes in your toes, especially if they persist for more than a day or 2, don't wait to see your doctor. Sign number 2, Lindsay's nails, a distinctive nail change that kidney specialists know well. Look at your toenails carefully in good light. In Lindsay's nails, the nail appears to be divided into 2 distinct zones. The bottom half of the nail, the part closest to your cuticle, looks white and cloudy, almost like frosted glass. The top half, the part toward the tip of your toe, appears pink, red, or brown. This creates a clear horizontal line dividing the nail into 2 different colored sections. This happens because kidney disease affects the tiny blood vessels under your nails, changing how blood flows to this area. The white portion indicates poor blood circulation and a buildup of toxins that your kidneys can't filter out properly. The darker portion near the tip shows where blood flow is still reaching the nail bed. Lindsay's nails can appear on your fingernails too, but they're often more noticeable on your toenails because circulation to your feet is already more challenging. This nail change doesn't happen overnight. You'll notice it developing gradually over weeks or months as kidney function declines. Once you see this pattern clearly established, it usually means kidney disease has been present for some time. The good news is that with proper treatment, kidney function can sometimes improve, and you may notice the white area of your nails starting to shrink as circulation improves. Sign number 3, swelling in your feet and ankles that doesn't go away with rest. Everyone experiences some foot swelling occasionally, but kidney-related swelling is different. Press your thumb firmly into the swollen area for 10 seconds, then release. If it leaves a dent that takes time to fill back in, this is pitting edema, indicating fluid retention. When kidneys can't remove excess water and salt effectively, fluid pools in your tissues. Unlike temporary swelling from standing, kidney-related edema persists even after lying down with feet elevated for hours. Your shoes might feel tight by day's end, or socks leave deep indentations around ankles. The swelling might be worse in mornings rather than evenings, indicating more severe kidney problems. Sign number 4, frequent infections in your feet that take a long time to heal. When your kidneys aren't functioning properly, your immune system becomes compromised, making it much harder for your body to fight off bacterial and fungal infections. You might develop athlete's foot that doesn't respond to over-the-counter treatments, or notice that small cuts and scrapes on your feet take weeks to heal instead of days. Bacterial infections might appear as red, warm, swollen areas that are tender to touch, sometimes with pus or drainage. These infections can start from something as simple as an ingrown toenail or a small blister from new shoes. The toxins that build up in your blood when your kidneys aren't filtering properly interfere with your white blood cells' ability to function normally. This means infections that your body would normally clear up quickly can become serious problems. You might notice that you seem to get recurring infections in the same areas of your feet, or that infections spread to larger areas before they finally start to improve. Some people develop chronic fungal infections between their toes that cause persistent itching, burning, and peeling skin that never seems to completely clear up. If you find yourself dealing with frequent foot infections or infections that don't respond well to treatment, this could be your body's way of telling you that your kidneys need attention. Don't ignore recurring infections, especially if you have other risk factors for kidney disease like diabetes or high blood pressure. Sign number 5, numbness, tingling, and burning pain in your feet, which doctors call peripheral neuropathy. When your kidneys can't filter toxins from your blood effectively, these harmful substances build up and damage your nerves, particularly the long nerves that extend to your feet. The damage typically starts in your toes and gradually works its way up toward your ankles and beyond. You might first notice a tingling sensation, like pins and needles, in your toes, especially at night when you're lying in bed. This can progress to numbness where you lose feeling in parts of your feet, making it difficult to sense things like the texture of the floor or the temperature of bath water. Some people describe the sensation as feeling like they're wearing thick socks, even when their feet are bare. The burning pain that often accompanies this condition can be particularly troublesome at night, making it difficult to sleep. Your feet might feel like they're on fire, even though they're not hot to the touch. This type of nerve damage, called uremic neuropathy, affects about 60% of people with advanced kidney disease. What makes this especially concerning for people over 55 is that it can increase the risk of falls because you can't feel your feet properly when you're walking. You might find yourself shuffling instead of taking normal steps, or feeling unsteady when you walk in the dark. The nerve damage can also affect your ability to feel injuries to your feet, which means small cuts or sores might go unnoticed and become infected. Sign number 6, restless leg syndrome that's worse in the afternoon and evening. This creates an irresistible urge to move your legs, especially when trying to rest. You might feel crawling sensations under your skin, or that your legs feel restless and agitated. The connection to kidney disease involves toxin buildup that your kidneys can't filter, potentially interfering with dopamine, a brain chemical controlling muscle movement. People with kidney disease are 5 times more likely to develop restless leg syndrome. Symptoms worsen as the day progresses, becoming most bothersome in evenings when trying to relax or sleep. You might constantly move your feet and legs, walk around late at night, or have difficulty staying still during movies or car rides. Sign number 7, sores and ulcers on your feet that won't heal properly. These open wounds appear anywhere on feet, but are most common on the bottom, around toes or at pressure points. When kidneys aren't working well, toxin buildup interferes with healing. Poor circulation means less oxygen reaches feet, and your immune system doesn't function as well. Ulcers might start as small blisters that break open instead of healing normally. Once they become open sores, they stay that way for weeks or months. The edges might look red and inflamed with drainage, ranging from clear fluid to pus if infected. In severe kidney disease, calciphylaxis can develop, where calcium deposits cause extremely painful ulcers that are very difficult to heal. Sign number 8, dry, itchy skin on your feet that doesn't respond to regular moisturizers. This isn't ordinary dry skin that develops during winter months or from aging. Kidney-related skin problems are caused by the buildup of waste products in your blood that your kidneys can't filter out effectively. These toxins get deposited in your skin, causing intense itching that can be almost unbearable, especially at night. You might notice that your feet feel constantly dry and tight, no matter how much lotion you apply. The skin might appear flaky, scaly, or even crusty in some areas. Some people develop what looks like a fine white powder on their skin, which is actually crystallized waste products coming through their pores. The itching associated with kidney disease is different from other types of itching because it tends to be deep and intense, and scratching provides only temporary relief before the sensation returns even stronger. You might find yourself scratching your feet until they become raw and bleeding, which then creates additional problems with infection and healing. The itching is often worse at night when you're lying in bed trying to sleep, and some people describe it as feeling like there are insects crawling under their skin. Regular over-the-counter anti-itch creams usually don't provide significant relief for this type of itching because it's coming from inside your body rather than from a skin condition on the surface. Sign number 9, symptoms of gout in your big toe and other joints in your feet. Gout is a form of arthritis caused by too much uric acid in your blood, and it's strongly connected to kidney problems. When your kidneys aren't working properly, they can't effectively remove uric acid from your body, allowing it to build up in your bloodstream and form sharp, needle-like crystals in your joints. The big toe is usually the first place gout attacks, creating intense pain that many people describe as feeling like their toe is on fire or being crushed in a vice. The affected joint becomes red, hot, swollen, and so tender that even the weight of a bedsheet touching it can be excruciating. Gout attacks often come on suddenly, frequently starting in the middle of the night and reaching peak intensity within hours. You might go to bed feeling fine and wake up with severe pain in your big toe that makes it impossible to walk normally. The pain can be so intense that people sometimes think they've broken a bone. While the first attack usually affects only the big toe, later episodes might involve other joints in your foot, including your ankle, heel, or the middle section of your foot. Between attacks, your toe might feel completely normal, which often leads people to ignore the problem until the next episode strikes. However, if the underlying kidney problem isn't addressed, gout attacks typically become more frequent and more severe over time. Some people develop chronic gouty, where the affected joints remain painful and swollen even between acute attacks. Now let's talk about protecting your kidney health and possibly reversing early damage. The key is taking action before symptoms become severe. First, maintain proper hydration. Women need at least 9 cups of water daily. Men need 13 cups. Your urine should be pale yellow like light lemonade. Dark yellow means you need more fluids. Completely clear means too much water. Spread intake throughout the day with small sips regularly. Second, exercise regularly. Aim for 150 minutes of moderate activity weekly, about 30 minutes 5 days a week. Brisk walking, swimming, or dancing all work. Exercise controls blood pressure and blood sugar, crucial for kidney health. Start slowly, even 10 minutes after meals helps. Third, follow kidney-friendly eating like the DASH or Mediterranean diet. Focus on lean proteins, fresh fruits, vegetables, whole grains, and healthy fats. Limit sodium to under 2,300 milligrams daily, or 1,500 if you have kidney disease or high blood pressure. Fourth, maintain healthy weight. People with BMI 35 or higher have 7 times the kidney disease risk. Losing 5 to 10% of body weight significantly improves kidney function. Fifth, control blood sugar. Diabetes causes most kidney disease worldwide. Normal fasting blood sugar should be under 100 milligrams per deciliter. Sixth, monitor blood pressure. Normal is under 120/80. High blood pressure both causes and results from kidney disease. Seventh, limit pain medications, especially ibuprofen and similar drugs. Using them over 10 days straight can damage kidneys. Take with food, never exceed recommended doses. Eighth, quit smoking. Tobacco chemicals directly damage kidney filters and reduce blood flow to kidneys. Ninth, get kidney function tested regularly. The EGFR test measures filtering ability. Normal is 60 or higher. The UACR test checks for protein in urine, an early damage sign. Before you start any new health regimen, especially if you're over 55, it's important to understand who should be extra careful with these recommendations. If you're taking medications for blood pressure, diabetes, or heart conditions, some of these suggestions might interact with your treatments. People with advanced kidney disease may need to limit their protein intake or restrict certain minerals like potassium and phosphorus. If you have a history of kidney stones, your fluid and dietary recommendations might be different. Those with heart failure may need to limit their fluid intake rather than increase it. Always consult with your healthcare provider before making significant changes to your diet, exercise routine highs or supplement regimen. If you notice any of the foot symptoms we've discussed, especially blue toes, non-healing sores, or severe swelling, seek medical attention promptly rather than trying to treat these problems on your own. Thank you for taking the time to learn about these important warning signs that could potentially save your life. Your feet are trying to communicate with you every day about the health of your entire body, including your kidneys. If you found this information helpful, please give this video a thumbs up and share it with friends and family who might benefit from this knowledge. We'd love to hear from you in the comments about your experiences or any questions you might have. You'll notice we have 2 videos on the screen now. I'm confident you'll find value in continuing to watch more content that can help you maintain your health and vitality for years to come.